Hi, this is Dr. Kristen Scatliff of MD Fem Incorporated. We really appreciate you tuning into our podcast, and we know that you value the information that we give as physicians, but I want to make something very clear. Do not use this information over the advice of your own primary care provider. That is the doctor that sees you. That's the doctor that knows all of your comorbidities, your medications, and everything else that's going on with you. We want you to take their advice. This is not formal medical advice. Okay? Feel free to DM us or email us at mdfem@gmail.com or on IG at mdfem or on our Facebook, MDFem Live. Thank you for tuning in. Hi, I'm Dr. Scatliff, and you're on with MD Fem Incorporated, and we have a special episode for you today. It is on lactation. We're calling it the Duct Dilemma, and we have on a very special guest, but we also have Dr. Candice Walben in the building, MD Fem Squad, and we have Dr. Shakira Henderson, and her bio is a whole bio. Okay, so I'm gonna take my time and read this properly. Okay. Dr. Shakira Henderson wears several professional hats, including a hospital based nurse researcher, health educator, and certified neonatal nurse. She is currently serving as the Vice President Research Officer for UNC Health, the Assistant Vice Chancellor Clinical Research for UNC Chapel Hill campus, and the Clinical Research Integrated Officer for the UNC School of Medicine. She previously served as the founder and senior administrator of the Vidant Health Center for Research and Grants. She is a lifelong learner and holds dual doctoral degrees, PhD and DNP, and a master's and two master's degrees in public health, okay, anatomical sciences, advanced nursing practice with a subspecialization in nursing education. She serves as an elected member and neonatal expert on the National Board for the Association of Women's Health, Obstetric, and Neonatal Nurses, and has recently been elected to be the 2022 to 2023 president. Whoop, whoop. This year, she was elected to the North Carolina Board of Nursing. She also serves as co-chair of the North Carolina Nurses Association and on the board council. And she previously served on an international board for lactation and was a fellow mentor and faculty advisor in Sigma's Maternal Child Health Nurse Leadership Academy. She currently serves as a faculty advisor for the new Sigma Nurse Leadership Academy for Practice. Her expertise is in the innovative application of research and nursing practice to increase the generation of research from the bedside and expedite the translation of evidence into practice. She is passionate about equitable breastfeeding and lactation opportunities for the residents of North Carolina. Dr. Henderson is interested in global health as she is originally from Dominica. That's one of her hobbies is traveling. And in her spare time, she enjoys sound sleep. We welcome Dr. Shakira Henderson.
Hi, thank you so much, Kristen. I don't know if it's to take a bow or sign an autograph.
Listen,
My
listen,
goodness.
listen. You
I
can
need
do
the
both.
autograph.
You
You
can
can
do
do
both,
both.
family. You can do both, okay? I've known Dr. Shakira Henderson, I want to say now for I'm telling my age, 2002? Since 2002.
No, I've only known you from 2016, so
Real
way back. I'm
wow.
Gen Z.
Mm.
I'm Gen Z.
Oh, we're telling stories today, huh? Okay. All right. So, anyhow, we're going to dive into this topic of lactation. And as a preface, before we go into it, I'm going to make a statement on behalf of MD Fem. And we understand that this is a sensitive, that's very topic, and that breastfeeding has traditionally been heteronormative. And so, we're committed to changing that conversation and to making it much more inclusive. And we also ask for your patience during this as we navigate the nuances of the conversation. So, we're going to flip in between saying he, she, they, them, and so forth. So as we use the pronouns, we ask for your patience. Okay, guys. We know that there's a difference, that we're trying to translate things from breastfeeding to chest feeding and so forth. So we're going to talk about all of that too. But let's start off with why breastfeed? Why breastfeed? What is the big draw?
So, Kristen, one of the most interesting things that we often try to navigate as we think about breastfeeding and chest feeding is the fact that breastfeeding is actually the norm
Mm,
and it's supposed to be the natural way to feed. We've made breastfeeding and chest feeding something abnormal, and there are many reasons for that. We'll talk about,
mhm,
some of the societal challenges to be able to get there. But breastfeeding is actually the natural normative way to feed a baby. And one of the most interesting things to me that actually took me back is when we think about breastfeeding and chest feeding, using all the appropriate terms, we have over 40 years of evidence
Mm.
proving that breastfeeding is the best way to feed your baby. In fact, one of the biggest facts that gets me, and it makes me wonder about how many more degrees I could have gotten if my mom breastfed me longer, is breastfeeding is the
Wow.
only way to grow the human
Oh,
brain. So I
wow.
always tell my
Oh,
mom, my
didn't remember
God,
that
if
one.
you had breastfed me past 2 weeks, maybe I could have 16
Well,
degrees. You know
well,
what I'm
so
saying?
listen.
But
So wait, listen, let's examine this. So that's the only way to cause like actual brain. So not the
breast milk
DHEA
is
that
the
they're putting in
only
the infant
way
formula.
to optimally grow the human brain.
Wow.
Wow. That's really interesting.
The only way to optimally
Wow.
grow the human brain. And let me put in a plug. If anybody wants to be in my clinical trial, I'm trying to grow brains up to 24. Let's see if we can grow the super brain. You know what I'm saying? Breastfeeding is the optimal way to go. It's the only way to optimally grow the human
That's
brain.
like,
And so
Wow.
I always like to say this to folks. We have less than 40 years of experience and evidence saying that smoking causes cancer. We have more than 40 years of evidence saying that breastfeeding helps moms and babies, yet we still struggle.
Mm.
So just food for
okay,
thought.
okay. So some of the struggles for breastfeeding, like one of them is the way society looks at breastfeeding, right? They sexualize breasts, right? So then breast became a thing. I don't pull out breasts in public, eh? And so now I think it was 2018 was Idaho and Utah were the last states to make it actually legal to protect. But in all 50 states, everybody,
Hmm.
it is legal to breastfeed in public. Okay, don't let anybody tell you anything different. So they've hypersexualized it. That's one of the reasons, right? That's become a challenge for people, right? So with so
Yes.
talk to me about like how do you help a mom kind of get over that, because some kids can't feed when they're covered, right? Is that true? Like I've seen.
No, that is not true. One thing I say about babies
Yeah.
is that they don't sacrifice anything else while they're eating. They will eat as long as they have the ability to eat.
Okay.
The only thing they'll sacrifice is not being able to breathe. You'll see them move out if they can't
If they
breathe.
can't breathe.
They won't sacrifice breathing for eating. But one of the things I like to talk about when we talk about challenges with breastfeeding is thinking about the history.
Mm,
So we know that in the 1920s, in the early mid 20th century, we had, of course, the women's era. And I apologize again because this is just historical
hmm
context. Using the women's era, women were going into the workplace. We were, feminism was huge in that era. In fact, some of you may remember having like that little hand with the woman with the tie around her head, and it was like free the woman from the
Yes,
breast and from.
yes.
So, what actually happened in the US and across many developed nations is that these women went into the workplace and didn't have the opportunity to breastfeed because they were,
Mm,
kind of liberated and empowered. They became the grandmothers in the 1990s and in the 21st century, and we lost that knowledge of community support
mm,
of breastfeeding. And so now we have a whole generation who is a little bit more woke and they're trying to breastfeed and chest feed and do all the healthy things for their babies, but they're being told by their grandmom, their moms who are grandmothers who never did it and can't support them, oh, that's gross. That's not really good.
mm.
Or I don't think you should do that. You survived. But we know that breast milk is really optimal for the baby. It helps with survival and it helps with a way of giving good nutrition.
Right.
So, it's interesting when we think about the barriers and how society has shaped it. And the formula company, of course, loves it because they use things like, as you said, the DHA and all the things that can grow the brain. Where do you think that comes from?
Mm-hmm.
Breast milk. They've
Mm-hmm.
synthesized proteins.
Right.
Where can you get the best proteins? From breast milk. Just like you're going organic, breast milk is the organic way,
And and
to
and
be able to
and I mean, we're
go.
talking about the benefits for the baby, but what about the benefits for mom? There's benefits for mom
Oh
too,
my
right?
goodness.
Like.
Yes. Ooh, this is one of the deepest levels of research when we talk about benefits for mom. Of course, the biggest one is it helps you get back to your pre-pregnancy weight quicker.
Mhm.
We know that. It really helps with decreasing postpartum hemorrhage so that you don't bleed after, because when you breastfeed, you release hormones that give you that contraction and keep you tight so you don't normally have
Mhm.
hemorrhages. Evidence has also shown that it's decreasing cardiac and diabetes, as well as cardiac and female cancers like ovarian cancer. So that's really, really good. And, we like to talk about the health benefits, but for me, I like to talk about the economic benefits.
Hello.
Hello, it is the
I
economic
know.
way to go because you don't have to buy all this formula.
I
You're
know.
good during the formula shortage. And it's the green way.
Right, right,
Breastfeeding
right.
I
is go
know.
We're
green.
so,
It's so
we're
true.
moving towards the eco-friendly way of life, right? And
I
so this
know.
is the most eco-friendly way. Yeah. So let's
And it's also the emergency approach. And I know we don't ever like to think about doom and gloom, but what if a hurricane comes? What if we get into a war? Guess what? You can still feed your baby and maybe some others as well. So, it's also the emergency, it's kind of considered the emergency plan.
right. So I want to ask Dr. Wall because she just had a little girl, and Isla, yay! And I want to ask her about going back to work and breastfeeding. How has that been? Because there's a lot of working women out there would like the that resource. How has that been for you?
So, I think it's been better. I think my first time around, it was rough because I didn't take sufficient time off. I mean, we can go into that too, how much leave we actually get. And I think that was, we don't have to go there. But I think that's the number one thing because my first child, he's 4 now. I took only 6 weeks. Yes, 6 weeks, and then I was still breastfeeding, and in my subconscious, I was like, wait, I gotta stack up because I'm going to work. I need to start pumping because how is he gonna eat? And it's like, and then stress normally decreases your milk supply. So just think about it. You're stressed going back and then away from your baby, and then okay, and then while you're at work, okay, I have to pump every 3 to 4 hours. It is a lot. It is a lot.
And then
So
where you're
being used to
working,
it, it was good.
do you have a place that you can pump? Is there a designated like lactation
Let's
room?
not talk
Because
about
that
that.
doesn't happen everywhere, right?
Let's not talk about that. You know what I was happy about? So during my time off, I went to the science world and there was a designated spot. And I was like so happy. I had a big smile on my face. I was like, wait a second, I can actually breastfeed somewhere. Because I was thinking, oh, I got to go back to my car to actually do this. So
Right.
no, I we have they have given us one of the rooms that we use as a patient room and say, okay, you can use this. And I
Okay.
was like,
Yeah,
okay,
yeah. Dr. Henderson, I don't know if you know,
Yeah.
like even in residency and fellowship, I had like
mm,
co-residents and co-fellows that would look for places to pump because like the pump room was like a
And you
small little
see,
closet that they had pulled together, and it was
yeah,
not the best place for you to like. There's not a lot of places that actually think about this is a place for mothers to it's not like they're encouraging
exactly.
the practice, and it's really kind of sad actually. And then I remember like co-residence males will be walking in on like a girl like pumping because she's in the mod room,
no.
and they'll be like whoa whoa whoa, and I'll be like it's normal. You are the one who sexualized breast. It's not whoa, whoa, whoa. You whoa, whoa, whoa. She needs to give her child food. Like,
Yes.
what's wrong with you?
Exactly.
So like that culture has to, we have to change that culture. Like everybody kind of was like, oh, she's pulling out the nipples. The child needs to eat on the plane. On the plane, isn't that the best thing to do? Because it pops their ears, right? It helps their relief of
Yeah,
their pressure,
Right,
right?
yeah.
I'm
right.
like, you don't want them crying and screaming. You let her pull that breast out. So it's like you just let her pull that breast out. I like to sleep on the plane. You let her.
I know we were not going to go there, but I think we have to go there when we talk about advocacy.
Mm,
So, the American Academy of Pediatric recommends that you breastfeed exclusively for 6 months,
mm,
and then continue up to 1 year when you give complementary food. And the World Health Organization says up to 2 years after your 6 months of exclusivity. But I know, we said we're not going to go there, but I do think we need to go to advocacy.
mm-hmm,
One of the biggest things I think in the maternal child world that we talk about is that we put out these recommendations, but there's no actual policies. to be able to support women to reach
Exactly.
those
So
pieces.
true.
So we don't have mandatory workplace lactation
Right.
sites. We don't have audits to be able to do that. We have none of those things. We don't have mandated maternal leave and paternity
We're one
leave to
of
be able
the
to support
only
families, to
developed
be able,
countries that
one of the
don't
only
have.
developed countries. And many countries actually protect the woman's
Thank
job up to a
you.
year, sometimes two
Yes.
years.
That's
So,
true.
what are we
Hmm.
doing? So,
Yes.
this is where the advocacy actually comes in. And I do want to address the stress of breastfeeding. Research does show that, when you have a little bit, when you have stress, it does stop, it can impact your supply,
Hmm.
but it's only temporary. One of the things I always tell, particularly my moms of color, I say, you know what? You think you have stress today? Guess what? Slavery was the biggest stressor in the
Say,
world, and they still breastfed.
say it again.
Boom.
Say it again.
Say it
Drop the mic.
again.
Drop
Say
the
it
mic.
They
again.
still
Drop
Say
the
it
mic.
breastfed.
again.
You know what I'm saying? So when you think about it, it does impact it. Don't get me wrong. It does slow you down a little bit. But what the research says is it's resilient because it's a natural way. Our body knows how to feed our
Thank
babies.
you.
So it will feed your
Thank
baby.
you.
It's
And
just that's
I
how the
mean,
world works.
we're gonna go in. We're gonna go in. Okay, you brought up slavery. You know who I am. Okay, so we're gonna go in.
Yes.
Okay, so we brought up slavery, right? And we were here feeding masses babies, eh? This is some of the scars that we have left. Okay, so we were here feeding masses babies, being the milk
Giving them
nurse,
the
the
good
wet nurse,
brains.
right? Giving them big brains,
Mm.
right? And having to feed our own children too, right? And so you're literally having to feed your oppressor. Think about the trauma of that. This is the person that's going to grow up to whip you. Think about that. So there's a trauma that was associated with breastfeeding, especially
Yes.
in our BIPOC
Yes.
communities. We have to acknowledge it.
Yes.
Okay. So when you say to me, oh, breastfeeding impacts everybody equally, stop. It does not. It does not.
No.
Okay. When my black and brown mothers who are working two jobs, okay, have to breastfeed, it's a different shape of things. Okay.
And let's get into
Yeah.
that, Kristen, because it's not just the really trauma that we carry genetically and we carry with our families. Think about that generation. A lot of times in slavery, the moms didn't get to breastfeed their own
Yes.
child. And in fact, because
Exactly.
it was such a negative experience,
Mm-hmm.
they didn't want to.
Yes.
So it was really terrible, for them to be able to do that. So
Exactly.
thinking about that, it's
It's
real. It's
real.
it's really, really real. And then the other thing that we need to talk about, and this probably spans racism in healthcare, is that what we're seeing and what we know is happening with our non-Hispanic Black moms is that they're not even being offered the support for breastfeeding when they're on the floors.
Mm.
What?
Many times when I
Mm.
counsel moms or when I
Wow.
meet moms or people reach out to me, they're like, well, nobody told me about those benefits. Had I known, I would have tried a little harder. So there's an equity issue going on.
That's
The
sad.
same way that we have these issues when we talk about maternal mortality,
Mm-hmm.
where we're not giving the same level of care to our non Hispanic Black moms, we are not giving the same level of support when it comes to breastfeeding. And in fact, what's interesting is that non Hispanic Black moms are the lowest percentage. Hispanic moms are actually on par with the national average. And of course, Asian and white and Caucasian moms are in the high levels of breastfeeding in terms of initiation. So this is a real, it's not just our women of color. Let's get it really
Right.
right as we
Okay.
put our different
Okay.
lenses. It's our non-Hispanic Black moms are suffering
Wow.
because they're not being inclusive when it comes to
So
support.
let's talk about this because I
Wow.
do remember when Candace was just gave birth, okay, and I was there for this period, and I came to the hospital. The lactation nurse was very like aggressive and wonderful and on it and like educating and helping her and this
Mhm.
and I mean like I was impressed. I had not seen that kind of you know the kind of the energy coming from that,
And was that a baby friendly hospital?
huh?
What did you say?
Was it a baby friendly hospital?
I believe so.
Do you
I
know?
don't
I
know.
don't.
I think so though. The
I would
vibe,
think
the
so,
vibe is very baby friendly. That's all I'm gonna
I
say.
would
I
think
mean, they're
so.
very.
Because if it is, that's
But
probably
I
why.
guess
Oh,
you would. I think also too, which is sad, but is true, is that they know I'm a physician,
oh, they knew you
so
were.
I have to.
Yes,
Oh,
That's why.
yes.
I think that's
okay.
why. Because interesting
Hmm.
enough, when I was having Elon, my nephew was actually having his son, and I had spoken to him about this. Was I think they were in New York, and I'd spoken to them about, hey, did you guys talk to the consultant about breastfeeding? Because yeah, and like you guys, I mean, when you leave, I mean, you can ask for like a breast pump, like all of that things, and they're like, no one came to talk about us. I didn't know we had to do. We could get all of that. So it's interesting that Shakira mentioned that because I'm like, wow, that's actually a custom of them not actually seeking out the black community to actually give them the same attention. It's sad
So let's talk.
because it's sad because even when Kristen was there,
See?
is like I needed it. Like I can't see myself not getting that consultation, and it's like I sought after them every day. That's how I was persistent because I'm like,
See?
oh, I need to find out how do I handle this. Like I need to keep up with my baby.
So
Like so
you
it's
were very assertive also, I want to say. You were very assertive about I need to know this, I need to know because you knew the challenges that you had in the first baby
yeah,
and then that was
exactly.
also that. But I'm like I'm flabbergasted because and this is for all of our listeners. Your insurance, whether you're insured or whether or not, you're covered for a breast pump. You're supposed to
Yes.
be educated. You're supposed to get a free breast
Exactly.
pump. You're supposed to be educated before you leave.
Everybody
Yeah.
That
should know this.
everybody should know
It's
this.
sad.
You should have
And
access to that.
interestingly,
Yeah.
most hospitals give free breastfeeding consultation even after you leave the hospital.
Yeah.
So if they're not telling you that, you need to seek that out
Yes.
because they have it. You can call the lactation consultant, you can actually
Exactly.
come back in their breastfeeding support groups. But our moms, our non Hispanic moms, are not being given that information. If they are, it's right before discharge, and nobody has the opportunity to be able to get that information.
That's just
So
Sad.
it's a real
Sad.
problem, and it's funny that Candice said I really needed to get that consult
I
because
did.
what research is showing is that the most influential time that impacts your length of
mhm.
breastfeeding is having that consult in the hospital.
Oh, I
It
can see that.
actually has a 4 to 6 month increase in your ability to maintain breastfeeding.
Wow.
So
Wow.
when you say you need it, you were right on point.
Wow.
It's
Because
true.
I mean the latching on, how
Yes.
do I hold
Oh, the
this
whole
baby? How,
positioning. Oh yeah.
positioning, all this kind of things. What happens when my nipples get engorged or my breast gets
Exactly.
engorged or I have
Right.
mastitis
Exactly.
or
Or the
what's
And your
soreness.
breast gets
It's
engorged after you leave because
yes.
we know milk comes
thank
in three
you.
to five
3 to 5
days. So what
exactly.
happens
When
It's
then?
the
interesting because I
Yes.
was still calling the lactation nurse after I left. I got on the phone. I was like, "Listen, what do I
Yes.
do with this? It's true. It's
when
interesting."
he said to her that this child may feed 14 times in a day, I said 14 times. This experience made me go, I could be a cool auntie that flies in and out. I don't need to have kids. I'm good. Like 14
Ah,
times in the day, you pulling out. Oh, my Lord. Jesus. I was
It
good.
gets
I
better.
always laugh. I tell folks it's kind of like some of us. We snack 14 times a day. Sometimes we drink a little water, we take a little snack.
I was like, I was like, what? I was, when I heard how much, I was like, 14. I was like, oh Lord. I was like, mm-mm. And then I think it's really important. So again, just to reiterate for our listeners, this is something that you are entitled to, eh? Please make sure before
Hmm.
Mm-hmm.
you ask for it if you don't see it happening and you demand it and you seek it out. You're your own advocate. You
Yes.
have to advocate for yourself sometimes. So
So true.
please, please,
And
please.
especially if you're a NICU mom, you do get that really high level pump. So you
Oh
want
yeah.
to think about that as well. If you're a NICU mom, you can get a hospital grade
Oh,
pump.
nice.
So make sure that you can also, and you can get that for free. They can arrange to have that get
Oh,
to you for free.
Oh,
I didn't even
So
know
keep
that.
that in mind. Hmm.
good to know. Good to know. Here we go. So now let's say, okay, so let's say I'm at home and I'm pumping and everything. What's the best way to store my breast milk? How long should I be storing it for? What's my recommendations here? Because that's something I also wanted
So I don't want to mislead any of our listeners. I'll tell you this. This is like the bane of my
to.
existence when we think about breastfeeding and chest
Uh-huh.
feeding and breast milk. Um, really make sure that you have your lactation folks give you the guidelines, because every 5 years or so we tend to change the
Okay.
guidelines. One of the things I tell my moms is that if you're feeding your baby and you put it in room temperature for more than an hour, it is no longer good. So that's a basic requirement. And it's interesting because that also applies to formula. So, when you see those moms in the mall and they have that ready to feed and
Mm-hmm.
they just keep on feeding for the whole 8 hours they're in the mall, that's actually not appropriate. So, we're
Mm.
talking about breastfeeding and we're talking about chest feeding, but some of these guidelines also apply to formula feeding.
Wow.
So, we want to make sure that we're safe. Some guidelines say that you can keep it up to 4 hours, but I like to be safe. I tell my moms, after an hour at room temperature, you want to make sure that, you may not want to use that milk again.
Okay.
But again, I always tell my moms, I have a little packet that I give them to make sure that they have the exact guidelines that are current. But talk to your lactation, talk to your nurses, talk to your physicians. That information is available to you
Okay.
at the hospitals, and different hospitals have different specific guidelines.
Okay. So now I have a question for you. Um, so we're talking we're talking straight here. I'm just gonna ask my wild questions, eh? So
Yay.
so what about moms who have had breast implants?
Oh, that's the coolest one. And Miami in the
Yeah,
house.
yeah.
That's my original my
305. The
original city. I mean
305. That's where
Miami
we
at
were. The
305 is breast implants. So it's
305.
interesting because a lot of times they say, oh, if you have breast implants, you can't breastfeed. It depends.
Mm,
So spent a lot of actually started my lactation career in Miami. So it's like I feel like I'm an expert on breast implants. The first thing I ask moms is if you actually know, where was the implant actually put in? If it was put in the breast tissue, then we might have some issues because some of the ducts might have been
mm,
impacted. We anticipate there probably will be some delays in lactation. But if it's done actually behind the muscle,
mm.
then we probably have a better chance of having more successful breastfeeding because the breast tissue is still in place.
Okay.
So just understanding most women don't know, or persons don't know where the how their surgery was done. That's easy to find out if you talk to your physician, and if you do, then you know how to set up your expectations
Right.
in terms of breastfeeding. And everybody's different. I've seen moms who've had it in the tissue and they've really been diligent with their breastfeeding, and they have more milk than I can imagine.
Okay.
So the truth of the matter is, breast implants do impact breast milk supply, but it's everybody's different, and all you need to do is try.
Okay, great. So now, next question. Okay, the Caribbean in me. Okay, the Caribbean moms and aunties used to say, you breastfeed for too long and they're gonna start to sag. Eh, you're gonna make the ligaments sag. Is that true? Is that true?
So I have to laugh because my grandmother said, "You are out here telling people to breastfeed. We're gonna have people throwing their breasts behind their back in no time." So I mean, and I said to her, I said, "Grandma, okay, you can breastfeed, right?
Mm-hmm.
What's going on here?"
Oh.
And she's like, "Excuse me, child." So I am here to tell you
Yeah.
that there are two things that help with your breast going down. One, gravity.
Yes.
Can't help
Can't
it.
help it.
It's going to go down. And secondly, the breastfeeding hormones naturally sag your breasts. So pregnancy and gravity and aging
Yeah.
are the three things that bring your breasts
Yeah.
down. So it's like it's not breastfeeding that's causing it. It's actually those three other things.
Okay.
Because I mean, there are people who've never breastfed, and I can tell you it's still going down.
Okay. 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 Wasn't ready. All right. No, but this is the reality, right? These are the myths that we have to bust because that's what people are thinking. This is the stuff that they've heard from their
Yeah.
grandmothers and their aunts and oh, you shouldn't do it for so long because X, Y, and Z. And I just want to break that myth for everybody. Okay, just break that. Okay, good, good. Okay, so now, Dr. Wall, I have a question for you. Okay, so you've had two kids now. You breastfed both, right? I have a question. So now, what with the formula shortage? Are you glad? Aren't you glad you stuck with the breastfeeding? Because I remember when you started out, you
Mm.
were like, "Don't know how long I'm gonna do this for, but let's have let's have that." Aren't you glad with the formula shortage that you stuck with it? I mean,
Oh yeah.
like it's
Can you imagine those two children that actually died from the formula? Can you
So
imagine?
to explain to the listeners, the reason we had a
Oh
formula
yes,
shortage here in
please.
the
Mm.
US was three different reasons. Number one, we were stockpiling formula during COVID. And then that caused them to bring down their production from these, and we only have limited companies that make formula in the US, unfortunately. And then the third reason was chronobacter. There was a massive infection, and it caused basically the children to go to ICU, and it can kill kids actually. And so that formula had to be thrown away. So that's why we have the infant formula shortage that we were going through now.
Oh.
And breastfeeding moms came to save the day because there's human milk sharing now. Human
Yes,
milk
there is.
sharing. So, Dr. Henderson, can you talk to me about that? Is that safe? Number one, like if mom is considering, let me go buy some milk from somebody, like because they're selling it online, they're selling it on Facebook and all these other mediums. So, like, how do you choose? How do you know? What do
How do
you
you
do?
choose exactly?
So this is where it gets really tricky and kind of scary
Mm-hmm.
to think about. I would absolutely not recommend
Okay.
that anybody buy milk online.
Okay.
There are actual certified milk banks that you can buy milk from that has processed the milk and pasteurized the milk. And I don't want to scare the listeners out there, but viruses can actually sip into breast milk. That's HIV. That's all the different viruses. We've had babies get HIV from moms who are HIV positive and breastfeeding.
Exactly.
However, one of the reasons they do that is because the benefits outweigh the risk.
Mm,
But you still don't want to take that risk. Now, here's the reality: milk sharing
mm-hmm.
has been happening for generations.
Mm-hmm.
It's been happening though in communities. So I cannot tell somebody who trusts, let's say, their sister, that they want to get milk from their sister that they know, that they
Mm-hmm.
trust, that they can get some milk from. That happens all the time, and there's nothing I can do for that. I can't recommend that. But I would definitely not buy milk online unless you're buying it directly from a certified milk bank.
Okay.
So you want to get it directly from a do not buy it on Craigslist, do not buy it on Facebook.
No,
Don't do any
I've
of
You
that
seen
because
showed me the
it's not
ad. Yes.
pasteurized and treated.
I've seen
That is the scary
this is it.
thing. There are a lot of
Yeah,
scammers out there, and
there's people that are out there
oh,
selling this and saying, "Oh, I'm a vegan mom and I eat this way and blah blah blah," and so yes, and selling their milk. And I
It was
go,
like $10 an ounce or something like that. I was
$10
like,
an
oh
ounce.
no,
And I go,
no,
this is
no.
insane. Like, how do you know this is safe? Because, like you said,
exactly.
HIV, but there's
Right.
also things like HTLV, guys, retroviruses
Yes.
Mm-hmm.
that
Oh.
later come back to haunt you in your adulthood and cause T cell lymphomas.
Exactly.
Mm-mm.
So you
Yeah, that is the
like cancer in
scary.
your adulthood from what was breastfed to you, eh? So let's be careful, guys. As she said, certified milk banks, certified milk banks. Okay, nobody buy anything from Craigslist, eBay, Facebook. Thanks so much, guys. All right, so I want to make sure we're all being safe because you see these things, and I sent the commercial to Candace because I was like, this woman is advertising on Facebook. She's got an ad running, like this is
She got
like
an
her
ad.
business, and I went, this is not safe. This is not safe. I don't care what you're
Remember,
eating.
breastfeeding emergency plan. We did say it was the emergency plan.
We did say that. We did say that. Okay, so let's discuss my our LGBTQ community because not
Hmm.
all mothers refer to themselves as she or as
Hmm.
women, right? And so how do we make this
Hmm.
conversation more inclusive, right? How do we bring that community in? Because like we talked about before, we talked about the milk sharing, and now there's
Yes.
co-lactation where two moms can lactate for the baby. Like how you're president elect now for the society. How are you
Hmm.
going to try to navigate or approach this for that community?
I think one of the things that we always try to do, whether it's in lactation or in maternal child care, is be inclusive. We want everybody to feel like they belong and can be part of the conversation. We know belonging is a fundamental human need.
Mm-hmm.
So we want to make sure that we're inclusive. The best thing that I would recommend is for us to be very transparent and ask people how they would like to be referred.
Yes.
So some folks might say, I am absolutely okay with you saying women and breastfeeding. Others might say, I really prefer for you to say birthing person or lactating person or chest feeding. I think we have to be really honest and transparent when we're dealing with different individuals and just ask,
Yes.
how would you like me to refer?
Yes.
And so many of the organizations are taking the approach that we're going to be all inclusive.
Right.
We're going to say women and lactating persons and birthing persons because we want to be more inclusive. We want to call people in, not call people out.
Right.
So that's one of the things that's the approach that we're taking. And when it comes to individual care, just ask. And if you are bold enough, just tell us, how would you like to be referred to and how would you like us to address it? So that's the approach that we hope to take.
Okay. Okay. Sounds good. And World Breastfeeding Week is August what, 1st to the 7th? Is that correct? Is that correct?
Yes,
Yes.
always in August.
So what can we as physicians do to help promote World Breastfeeding Week with our patients? Like how can we guide them?
So one of the things I can help you with several levels. So let's start with the organization levels. As physicians, I think you can advocate for your hospitals to become baby friendly, which means that they actually adhere to the 10 steps of successful breastfeeding with the World Health Organization. We have, I think, about 24% of births in the US now being born with babies being born in a baby friendly institution, which is, I think, 1 in 4 babies, and that continues to increase. That ensures equitable care, which means that there are certain things that have to be done. And when they do become baby friendly accredited, there's actually an audit and a site visit to ensure that you're offering all moms a lactation consult. And in that site visit, they actually talk to moms and call moms
Oh,
who've
nice.
had experiences at the hospital. So it's absolutely random. Yeah, it is a really great accreditation, which now allows equitable care. So now we can't just pick and choose who we want to give a lactation consultant.
Right.
It is very in depth. So I think as physicians, you can advocate, can we try to be baby friendly so we can have equitable care? And then again, I mentioned earlier that you are the most important factor that can influence a mom to be able to make a decision for breastfeeding and also increase her duration of breastfeeding post discharge. So spending time with your moms pre coming to the hospital, her 3 days are not the time to jam pack all of that breastfeeding information.
So true.
Making sure that if you are in practice before the hospital, that you have breastfeeding information those whole 9 months. 9 months, you have a long time to be able to support your mom. So make you can include breastfeeding in every visit that she has. It doesn't have to be you, but the attitude of the physician makes a difference. Moms trust their OBs. They trust their physicians. And so if you are of an attitude that's supportive of breastfeeding, they're most likely going to want to breastfeed because you are the most trusted person that they have. And when you're in the hospital, just encouraging that. And then post discharge, when you see the moms, encouraging that as well. I'm also going to put it out there, encourage and collaborate with your lactation consultants and your lactation specialists because you might not have time to sit and help a mom to breastfeed or hand express, but you can certainly connect her with the lactation consultant who can spend that much time. And that makes a difference when you say, you know what, let me get that lactation consultant for you because it's so important that you live here breastfeeding because I know you can. They trust you, they look up to you, and you can make that difference.
Wow, wow. So I'm going to say on an adjunct
So
to what
true.
you're saying, I'm speaking to my critical care docs like me out there, okay? When you
Mhm.
have postpartum mothers that come to your unit, it is your responsibility as the critical care physician to ask, did she want to breastfeed? Okay? Because there's
Yes.
certain medications that we cannot give them that will translate into the milk if we give
Right.
it, right? Number one. Number two, You have to pump. She'd have to pump. If she's intubated and sedated, she can't pump. So we have to call the lactation consultant and have them help us manage this patient. I
Yes.
always do it, and all the other docs go, "Why are you putting all this effort into the lactation?" Because this breastfeed, that child is still in play. Hey, that child is still in play. That breastfeeding should still
Excellent.
happen, okay? And he has the right to his mama's milk, or she has the right to his
Yep.
mama's milk. So no, no, no. I'm not giving propofol. No, no, no. Okay.
So
No,
I
these things
know. I
build them up,
really
right?
commend you. I really commend you because I've seen it. The mom go into ICU, and I automatically think, okay, no, they're not going to be able to
You know what
Excellent.
they
breastfeed. But
used to do?
I,
So you have to
I'm on
remember that
that too.
critical care is a very masculine
Yep.
energy, right? It's been male dominated. So
Hmm.
unfortunately, they were not always sensitive to this issue. Okay, SCCM and so forth are trying to shift it now, but before they weren't, and so they were like banding the breasts, eh? Stopping the
Yep.
milk
I
production.
see that.
So
I saw
so
that.
so I've seen that before, right? And
Mm.
so I was like, what? I was like, did she like? I would talk to either the father of the children or their partner or whatever, whether it's a he, she, they, and basically they like, hey, what did they want to do? Did they want to
Exactly.
breastfeed? Like, have they been breastfeeding their previous children
Wow.
before? Like, what was the plan with the OB? What was the plan with the pediatrician? Like, things of that nature. And then once I get that, I go, okay, so that we're going to continue the plan. There's a way around it. Call the lactation consultant. They know what medications I can't give that are going to go into the milk. They know what to do. Like they're going to come and pump her. They're going to come and make sure that these things happen. And then I get to manage her outside of that. Like if you're intubated, you're not going to be able to pump or give breastfeed your child, right? So, and in COVID, that was a
Mm.
very big issue for us, right? So,
Yes.
and outside of COVID, it's an issue too. So I want my critical care community to start thinking about lactation. It is your issue. It is your problem. We need to be involved in it. We need to consider it when we're managing our patients. Absolutely 100%. Do not stop that process. Please advocate for your patient on every level you can. So, thank you for saying, that we can call a lactation consultant and, working
Hmm.
with them. You learn from your support. These ancillary services teach you so much as a doc, eh? So don't
They do.
don't dismiss them. Don't dismiss them. Please, please learn that number. Keep it on the back of your ID. Call them because postpartum ICU patients are some of the most difficult to manage. So you really do need the support
Yes.
of the OB and of everyone in the team right there to help you
Mhm.
out. So
Right.
so I mean, we're gonna end the conversation here. But I think we're going to have to do a part two at some point. This was amazing. My mind is
This was
blown.
good.
Like, we didn't even get into certain things, but it was so great
I
having you, Dr.
know. Lots
Henderson.
to talk
It's so much
about.
to
It
It
do.
was
Oh
great
was.
to
my
see you
God.
both. Oh my
It
Yes.
gosh,
was.
this is great.
Thank you for joining us. And thank you for joining MD Fem, guys. Good night.